Hello, my name is Sілке Madер. I'm the co-founder and chairwoman of EFCNI, the European Foundation for the Care of Newborn Infants. It is my pleasure to talk to you today about why a zero separation policy during the pandemic is a very important issue in the NICUs. We all know that preterm birth complications are the leading cause of death among children under 5 years of age. But how does the situation look in Europe? It's the same, that in European countries, we have a huge number of premature births, but also in the end, the challenges of an outcome. Having this organization founded in Europe, we learned quite soon that all over the world, this topic is a big issue. Therefore, 2 years ago, we founded GLANCE. GLANCE has the vision that all over the world, babies receive the best start in life. And our mission is really to reduce the mortality and morbidity rates. We want to decrease the burden of the families and also collaborate with multi-stakeholders all over the world to really reach this goal of reducing the preterm birth rate, but also improve the outcome of our children born preterm or sick. Realizing this is to collaborate with different stakeholders, with policymakers, with healthcare professionals, with industry partners, but also with the parents who are affected, and also for the ones who are now young adults, like my son, who is now 24 years old and was born with only 550 grams. When we look in Europe, how the situation is there, and coming from a very rich country, Germany, we always think we are much better, like in the developing countries or in the middle income countries. But when we look here all over Europe, we see that in countries like in Bulgaria and many East European countries, the mortality rate is really high. And we know also that Germany, for example, has one of the highest preterm birth rates across Europe, and we are one of the richest countries across Europe. So therefore, there is a need to talk about, well, how can we improve the care for our children? How can we reduce the mortality and morbidity rates? Because it costs our societies an enormous amount of money, and it is a huge burden lifelong for the families, and of course for the preterm born babies who are growing to young adults. And later we have a huge impact on the health cost for all the societies. So what are the long-term consequences? So we know that a lot of physical disabilities, like cerebral palsy, is one of the big issues. We know that learning disabilities, behavior problems, psychiatric disorders like autism is one of the key issues for the very preterm babies. Respiratory diseases, of course, for the long ventilation time frame, cardiovascular diseases, but also visual diseases when babies born preterm get an ROP. But what does this mean for the long-term outcome? So we know that many of these children are diagnosed in the first years of life with different kind of disabilities or challenges, also developing delays, and therefore they not reach the goals for going in a normal school. And later that means that they cannot earn the same amount of money as they would have a university degree, for example. We know that also the integrations or the behavior challenges some of these children really have, make problems in the peer groups. They have challenges to find a partner. And we know that many of these children who are now young adults or even adults around my age end up in poor adult health. We know all that we have to work on evidence-based practice. We know for more than 20 years now that family-centered developmental care, so to integrate the family in the care of the children, improves the health outcome of our children. But most of our NICUs all over the world look like the first picture, that there are just a few parents, and or we have this open bay units, but we have not the integrated family-centered care aspect in all over the world. When now we come to COVID, we know that the majority of NICUs all over the world closed their NICUs and parents couldn't see their babies. The parents, some of the parents can come for 5 minutes, even less, even more, but fathers also were excluded. So how can we ensure that in the future we have a better family-centered care aspect in each NICU in the world? The virus really changed everything. We know that many of our colleagues in the NICUs were, of course, very scared that they get the infection. They were scared of having not enough hygiene equipment. They had a lack of human resources. Many doctors and nurses were affected with the virus, and also many of our nurses and doctors all over the world died because of the coronavirus. Nevertheless, we all know that the baby and the parents belong together. And we have heard from all parent organizations across the world, quite after the coronavirus came as a pandemic all over the world, that the NICUs were closed. So we heard that there was a huge separation, the very beginning, totally separation. Some of them started a little bit with 5 minutes, 10 minutes, open the NICUs. We also heard that some of the NICUs didn't change any policies and welcome parents still 24/7. Just last week in the Lancet, there was a publication that the benefit for KMCs or kangaroo mother care is 65-fold higher than the risk of a mortality belong to COVID-19. And we all know that the kangaroo mother care improves the care or improves the outcome of children. It's also important for life saving. And we know that the bonding is much better. So we know that when we have proper hygiene measurement, when we have enough safety aspects and we all take care about it, we have to really put parents and the family and the baby again together. This really, we should not harm. That's one of the philosophies and also, of course, regulations when you are a healthcare professional. But separation is really harmful and has a consequence lifelong of the whole family, not only of the baby, it's also for the whole family, that the separation can go to depression of the mother and also to the father. What we have done as an organization, Founding Glands 2 years ago, we have heard that many parents had a lot of questions, but didn't really get proper answers. Therefore, we collaborated with a couple of healthcare professionals, also with WHO, to provide for pregnancy, birth, breastfeeding, NICU, the time in the NICU, but also discharge and follow up a couple of questions and answers, also evidence-based answers that we can support the parents. We also have organized worldwide in 55 countries in more than 20 languages, a survey how the situation really is. And what I can tell you already, and you will get more information in a publication, we expect this in summer, but one thing I can already tell you, that 1/5 of all babies born preterm across the world haven't ever seen their parents before discharge. So 1 baby in 5 has no contact at all to their parents before they discharge. And we all know what the consequence will be. The psychiatric disorder, the psychological burden of the whole family, and also the consequences. We know that kangaroo mother care, breastfeeding is key for a really proper outcome. So this is really heartbreaking to hear that so many babies in the world have such a really strict separation experienced. What we have done to change the mind, to change the situation, is to develop a campaign called Zero Separation Together for Better Care. It is translated in 27 languages and supported by 120 organizations. Nevertheless, we know that in more countries, in much more countries, there is a separation policy, even if the society have signed up for this campaign. So we developed in the end a campaign who brings up all the topics. And you see here some pictures. One was the general situation that families should not be separated. One is the discharge situation. So when the baby is coming home or when the babies are at home, how are the follow-up and the whole therapy is organized, because many appointments were canceled. We should not forget the fathers and other family members, that they also have the right to see their baby, to see their grandchild. And we know that a lot of these families already suffer with depressions because they are not, cannot cope with the situation, that they not see their baby. So we really look into the different aspects of the zero separation and try to convince people really to change their mind. And just this week, I have given a presentation at the G7 preparation meeting, because the zero separation is really something what WHO is supporting us, UNICEF. We know how harmful separation is, and all politicians should know that this is nothing to really think it's, well, you will see your baby in 4 months. We know that the burden will be high, lifelong for the whole family. So when we talk about, and many of you in the Ukraine know also the European Standards of Care for Newborn Health Project, and I have given already several presentations in your country, or some of your colleagues were at the Ministry of Health, so that this project is something where the Ukraine is really looking for improvement and looking really to implement it, and also helped us to translate the materials into Ukraine. And when we go in one of these aspects, it's family, infant family centered developmental care. And you see here the statement of the standards, or you see here what is important for integrating or implementing this into your hospitals. And one of the key aspects is parents should be the primary caregiver, should be responsible for the baby. How should it be when they are separated and have only visiting hours? We are no visitors. We are the parents of this child. We should really have continuous access 24/7 to our child. It's our child. It's not the child of the hospital or the system. We should really try to offer skin-to-skin care or kangaroo mother care whenever it is possible. We also, of course, should support the healthcare professionals to be able to provide this support. But when you only see in this face of this beautiful mother with her tiny little baby, you see why it is so important. You need to make these parents feel that they're parents. And so therefore this baby is going home with the parents and not with you. So we have to ensure that they feel self-confident, that they feel they are the parents of this tiny little baby. And so we have to ensure that this takes place. And we know from the health outcome that these babies have a better outcome later in life. The brain development is better, the lung development is better, the infection rate is decreasing, and even the hospital stay decreases when we have a really family-centered care aspect involved. How is the situation across Europe? As mentioned before, we have the situation of a total separation in some of the hospitals. We know that also in the Ukraine, it's challenging really for many parents to see their baby every day. So we know that we have the situation at 5 up to 10, 15 minutes per day. Some hospitals allow to see their baby. And I don't like the word allow, because we should not be allowed. This is our baby, as I mentioned before. We have that situation that only one parent can see the baby, mainly the mother, but not the father. So please don't forget the fathers. It's also their child. And we have some situations, a few hospitals in Germany, but also in Sweden really changed nothing at all. But we also have in Germany, in the meanwhile, hospitals that separate, especially the fathers, for only twice a week. And this should not be the case. So just to summarize a few points why it is evidence-based that this separation is harmful. We know that breastfeeding and also providing the pumped milk, so the expressed milk, is really important for the outcome of the child. We know that the neck reduction is high when breastfeeding can be provided, or the mother's own milk can be provided. We know that in the end, the kangaroo mother care reduces the mortality by 40% of the infection or sepsis, and sepsis 65%. We know that also the hypothermia aspect, of course, is important to see that the baby really is kept warm. We know that later the behavior aspects and the behavior outcome is better when kangaroo mother care or skin-to-skin care can be provided. And it's also logical. When you never feel your baby, when you never smell your baby, when you not feel as a mother, how can you later, when the baby is discharged, feel now you are a mom? That's really quite logical. But now we also talk about really hard evidence. And I know that you need this evidence in the end to argue in front of decision makers. Finally, also, of course, the parents aspect. are important to see. We know that the weight gain is better when the baby gets breast milk. It decreases the stress of the mom and also the anxiety of the parents. When you see and touch your baby and smell your baby, you have a better language outcome. And this is, again, when you remember on the slide before about the outcome, long-term outcome, where we all want that these babies later in life are normal adults, normal children. We have to help them to become a normal child with a normal family, and to really separate the baby from the child, the baby from the parents, is a key aspect of reducing this opportunity to have in the end a healthy child, a healthy family, and also a healthy parents, because they need to take care of this child. And the reduction of stress is important to have in the end a really good family situation lifelong. And this, I can speak from my own experience, is challenging when you have a child or a young adult with 24 years old, where you always try as a helicopter to observe after so many years. And this should not be the case, not today, even not in the time of the pandemic. So I thank you very much for your attention, and I hope that I could convince you in my presentation why it is so important to follow the zero separation policy, to not harm, to try, of course, the best for yourself in the taking care of hygiene measurements, but nevertheless to think about why you're doing this work, why you are being a neonatologist and a neonatal nurse or a policymaker, how to improve the care for our children and not bring this situation of the pandemic to even worse outcomes as we have already because of the infection rates. We have to see how we can reduce the risk for our preterm babies to in the end have even more burden on their shoulders if they already have, because they're being born preterm. Thank you very much for your attention. And of course, I wish you all the best for yourself. Thank you very much.